You know that would suck. All right. I am Angela Scott. I'm going to be um, I'm going to place an NG tube today, as well as, perform a gastric lavage and administer a feeding of Glucerna per the MD's orders. So first, I'm going to start with my 12 safety practices. Um, I'm going to verify my orders. I'm going to verify my facilities, policies, and procedures. I'm going to check the manufacturer's procedures based on the equipment that I'll be using for the day. I'm going to perform hand hygiene before and after touching any of the equipment. So I'm going to knock on my patient's door. I'm going to note the overall condition of the patient. I'm going to introduce myself and explain the procedure. I'll provide for privacy. I'm going to raise the bed for good body mechanics and don any PPE if necessary. And I would perform the procedure, and I would report any abnormal findings to the charge nurse. Then I would, I'll go over these 5 or 6 rights of medication. So right patient, right dose, right time, right medication, right documentation, dose, time, right patient, time, dose, right route. So I would do all those things. So now I would have performed hand hygiene. I'm going to put on my gloves. And I'm going to take out my tubing, and I'm going to put the lubricating gel on the tube, and then I'm going to instruct the patient to have their head up, and I'm going to start to insert the tube in their nose. And once they feel that little tickle, I'll instruct them to put their head down, and I would have somebody in the room helping me and having them sip water as we get to that point. So I'm going to measure my tubing, starting at the nose to the earlobe, and then I'm going to measure from the earlobe down to the xiphoid process, making sure that I mark off at the limit that I would insert the tube. So now I've got the lubrication on the end of my tube, and I'm going to start to insert. So I'm going to insert, then I would ask them to put their head down and sip the water, and I'm going to insert until I have met kind of where I've taped off my tubing. Then I'm going to take my tape, and I'm going to tape it to their nose. And then what I'm going to do is make sure that I have enough tubing, and I'll tape the tubing to the patient's gown, making sure that they can still move their head without the tube falling out or being ripped out. So I've inserted my NG tube, and now I'm going to note the overall care of the patient. I'm going to say how they tolerated the procedure. And before I would start placing the tube, I would do an abdominal assessment, making sure that they didn't have any prior surgeries, no tenderness, no dissension in the abdomen, and I would note all of that in my findings before placing the tube. So now I am going to check my orders. And I'm going to check my orders. I've placed my tube. I'm going to send the patient for an x-ray just to verify placement of my tube. And then I'm going to check my orders, and so I would come back into the room. I'm going to perform a gastric lavage until, I have clear contents coming out of the tube. So what I would do is take, I would also, before leaving the room from the NG tube, I would connect this to section intermittent on low intermittent section. So now I'm going to come disconnect this from the section. I'm going to unclamp this, and I would have my saline in here. I'm going to take the syringe and I'm going to get the saline and I'm going to pump it in. I'm going to hold this 8 to 10 inches above my patient, and I'm going to let the saline go down the tubes, and I'm going to repeat this process until the contents that I get are clear, that I'm sectioning out, that are clear. So I would empty, saline, empty until it's clear. Then what I'm going to do is recap this and perform hand hygiene, document how the patient tolerated this procedure, and report any abnormal findings to the charge nurse. Now, let's see, it looks like there's like a 2-day span. I would come back and we're gonna do a feeding of Glucerna 1.5, and then in 100 mLs, and we're gonna flush 50 mLs of water. So I'm going to come back, let the patient know what we're gonna do. I'm gonna unclamp this from the sectioning, and we're going to take our syringe and we're going to attach it here, and we're gonna pour in 50 mLs of warm water to flush the tubing. And then we're gonna, as long as my residuals that come out are less than, let's see, the doctor's ordered less than 150 milliliters, I'm gonna, is that right? Yes. And then I'm gonna go ahead and proceed with the feeding. So I flushed my 50 mLs of warm water, and the residuals are less than 150. So I'm going to pour in 50 mLs of the Glucerna. I'm going to let that go down the tube, and I would continue with the administered amount of Glucerna until it's gone down. And then I'm going to flush with 50 mLs of warm water and let that go down into the tube. And then I would detach this and reclamp, and I would hook it back to the section at low intermittent suctioning. I would place that back on the patient. I would note how the patient tolerated the procedure, ask them how they're feeling. I would note any abnormalities and report that to the charge nurse, and I would follow up with the patient, within 30 minutes of the procedure, just to see how they tolerated it. And that's it. Thank you.